area. And then the other thing, I know you said you wanted to get a little bit of an eyebrow lift on the sides. We can actually do a little bit in the corners of the eyebrows to kind of turn the eyebrows up a little bit, kind of lift them at the corners. And then if we want to do a couple units around the outsides of the eyes, go ahead and smile really big for me. You know, just to help soften a couple of those lines. You don't have very many, but we can definitely soften a little bit. And then like we talked about, we can definitely do a little bit in the corners just so that muscle doesn't pull down. It will just kind of relax a little bit. Okay, cool. So I'm just going to take, use alcohol and just kind of take the makeup off just those areas, all right? Okay. Perfect, all right. So go ahead and relax back for me.
So how many units are you thinking?
Yeah, so what I'll do next, after I take this off, I'm just gonna mark with my pen. Then that will give me an idea of how many units I want to use. So I'll definitely let you know before we do any injections. And I know you've already told me that you don't want to look fake, you don't want to look overdone, so it's just a really natural, so you don't have the face that's a bit harder when you're resting. You want to be just a little bit more relaxed, and approachable. Yeah.
Yes, approachable. That's my mom's favorite word.
Yeah, that's a good word. Approachable. So a little bit on the corners of the brows. This is the one that will kind of lift the eyebrows a little bit. Okay. One more quick swipe. I just want to make sure that all the makeup's gone for where we're doing the injections. We're going to do a little bit over the eyes. Sorry, this is strong because it's alcohol. It's really close to your eyes. Good. Same thing on this side, just cleaning that area off. And then same thing down here, just taking a little bit of that makeup off. I'm going to grab one more alcohol swipe, and then I'll use my pen to kind of mark first where I want to do the Botox, and then I'll give you an idea of how many units we're using, okay? Okay. All right, perfect. Bye, face. All right, go ahead and look at me to start off with, okay? I'm just gonna mark. All right, go ahead and make that concentrated face, so push those eyebrows together, good. Good, and relax. Good, and then I'm gonna do a little bit on the corner. Good, and then smile big for me. Good. Good, we're gonna do a little bit around the eyes and smile big. Good, we're gonna catch a couple of the lines that are starting to come up this direction. And then the next one is I want you to make that pouty face for me, so go ahead and stick that bottom lip out. Yeah, just like that. Perfect, just like that. Okay, so let me just write those numbers down.
Is this your first time getting Botox, Sadie?
This is my first time. I'm a little nervous, but I know I have a great doctor.
Well, thank you. I'll take good care of you.
I learned that Botox is almost better as a preventative measure than after you actually have the wrinkles. So it kind of spurred me into wanting to get this. And I'm very excited that I can just have a little lift and be more pleasant looking.
All right, so Sadie, for you, what I'd like to do today is I'd like to use 40 units. I know that sounds like kind of a lot of units, but I'm actually going a little bit less in pretty much all of the areas because your lines are so, they're so few, but again, preventative, so you don't form the deeper lines, is a really good option. So for instance, right here, we're actually going to use 18 units. Okay. So, and according to the picture, usually I use 18 to 30, so you're right on the kind of lower end of normal. We're going to use just a couple units in each eyebrow. That's to give you a little bit of a lift. And then usually I recommend 9 to 12 units around each side of the eye. Again, you have very soft lines. They're kind of just forming. So as a prevention, we're just going to do 6 and 6. And then just a few units in each muscle down here, okay? Does that sound good?
All right.
All right. I will get that all drawn up for you.
I think it sounds good.
All right. And then Sadie, you're not taking any blood thinners, correct?
No, ma'am.
Good. And then you don't have any neuromuscular disease like ALS or MS?
No, ma'am.
Good. No egg or anaphylaxis allergies?
No, ma'am.
Good. And you're not pregnant or breastfeeding?
Nope. Definitely not.
All right. And no medications, it looks like. Is that correct?
That's correct.
All right. Well, you passed the test, so that's good.
Yes.
You can get Botox today.
Yes. The few and the brave.
Perfect. So all I'm doing over here is just getting everything drawn up. I kind of label out the areas that I'm doing, so I will draw everything up separate. It makes it a little bit more comfortable for you if you don't have everything in one syringe, because then that means there's less pokes with just one needle.
Cool. All about that.
Yeah, so it's a little bit more comfortable, so it takes me just a moment. And again, this is nice because, you know, with a filler, you get a syringe, so you use the whole syringe, but with Botox you can really tailor it to the individual. So how many units each individual needs varies, so I can draw up however, you know, many or few units that you need.
While you're doing that, I'm going to take a look at this handy little guide about how many units typical people use. What are the bunny lines around the nose?
Yeah, those are actually the lines when you make they literally are kind of the bunny lines. That's the muscle called the nasalis. So that's the actual muscle. What that muscle does is kind of turns, you know, kind of forms those lines that run this way along the nose. So you can actually do a little bit of Botox in there to get rid of those. That's not a common one that, you know, people are coming and asking for, but sometimes what they'll notice a lot of times with doing Botox is, you know, you'll get this area will really smooth out, you'll get a nice eyebrow lift, you'll get smoothing on the side, and then probably the next thing that you're going to say is you'll come in 2 weeks and then you'll say, well, what about these lines? Because now everything's nice and smooth around my eyes, and I can see when I smile, I have these little lines that form around my nose.
Okay.
So that's another area that we could add if you wanted to. And I always recommend that my patients, especially first-time Botox patients, follow up in 2 weeks. So I will see you back here in 2 weeks, and that way we can take your photos and make sure you're happy with the treatment, see what kind of changes we've made, and that gives us an idea for the future of, is this a good treatment for you? You know, was 40 units enough, or was it a little bit, you know, too light, or was it a little bit too much? So we can always make those determinations when I see you in 2 weeks.
Okay, perfect.
All right.
While we're waiting, Sadie, have you ever had any other aesthetic treatments?
I got a photo facial about a month ago and laser genesis. So the laser gen works on acne, and I have like subdermal acne, so it doesn't come out. So the laser gen worked on that, and then the photo facial on top of that works for pigment issues. A lot of people have, they explained to me, a lot of people have a lot of brown spots or aging, or age spots, but I have more of a red pigment issue, and they showed that with the photo finder picture thing they take. And so the photofacial targets the color and pigment in the skin and works to smooth it out or bring it out. So I should start, the results of that actually progress. So over time I'll see the more results of that. So the laser gen definitely works because it's bringing out, it's purging acne, which is lovely, but that's what we want.
But good for your skin. Okay.
Yeah.
And today we're doing Botox for the very first time.
First time, 26, starting early, starting prevention.
preventative Botox is the best.
I'm going to be 26 forever. In 10 years, I'm going to live just
Don't
like
we
this.
all wish? Yeah.
Wait a minute. That's in the paperwork.
Wasn't that a guarantee?
Wasn't that a guarantee?
Yeah. Might be at the wrong place.
Oh.
No, we need to go to the Fountain of Youth.
Oh.
Yes.
That's not, Chandler, not okay, got it.
All right. So I'm just gonna lean you back to do a couple of these injections, okay?
Okay.
All right. I'll give you a little squeezy ball too, if you'd like. Yes.
Oh, yes.
All right. I'll take this mirror from you, and then here's a little squeezy ball for you. All right.
Hi, Mom.
Botox for the first time. All right.
Focus, listen, breathe.
That's right. So abide by the rules.
Yes, ma'am.
All right. So basically, I'm going to have you make a couple of the faces that I had you make before.
Okay.
You will probably feel a little pinch, but that's pretty much all you feel.
Oh.
Okay. So it'll be pretty darn easy. You might feel a little bit of a pinch. There are certain areas that are a little more tender than others.
Okay.
This area seems to be pretty good. You know, around the eyes, we have a few more blood vessels. We have some more nerves around there. So sometimes those ones are a little bit tender. And then other than that, though, you're going to feel a little pinch, and it's over before you know it, okay?
All right.
All right, so there's my touch. Go ahead and make that concentrated face. Push those eyebrows together. Good, relax. Good, here's the first little pinch.
Oh.
Yeah, go ahead and make that face again. Push those eyebrows. Good, relax. Good, perfect. Relax those muscles. How you doing?
Oh, fine.
Yeah, right. All right, go ahead and make that concentrated face. Good, relax. Good, a little pinch. Go ahead and make that face again. Good, relax. Good. Almost done in this area. Good. And then last one, go ahead and make that concentrated face. Good, relax. There's a little pinch here. Good. So that area is all done, okay?
That was a breeze. I
Yeah.
was worked up about nothing.
Yeah.
Great.
Truly. That was like,
Yeah, it's, you know, I mean, you feel a little pinch and that's it. All right, so for the next one, I'm gonna have you raise your eyebrow up as much as you can. So eyebrows up, good, and then push your eyebrow into my finger as much as you can. Push, good, and then relax. Good, and we'll pinch here. And that's it for that area. That's a little one to make sure that your eyebrow stays lifted in the corner. And then I always have my patients make the muscle movements like I'm having you do. Not all injectors will have their patients do that, but for me, I can see the muscle that I'm working on a little bit better and kind of feel it. So
okay.
go ahead and raise your eyebrows up. Good, and then push down into my finger. Good, relax. Good. I think we're gonna get a nice eyebrow lift on you.
Yay!
We're almost done. We're gonna just do a few injections around the eyes, okay? Go ahead and face me this direction just a little bit. Perfect, just like that. So I'm just gonna kind of take a look for any blood vessels. Of course, when you're doing injecting, you wanna try to avoid blood vessels.
Thank you.
Yeah, you're welcome. You can see you have some there. We'll definitely avoid those. Go ahead and smile big as much as you can. Good, and relax. Good, here's the first little pinch on the eye pinch. Good. Go ahead and smile big again. Good, relax. Good, here's a little pinch. Good, and then go ahead and smile big again. Good, relax. Here's a little pinch here. That one's a little more tender, usually that spot. Overall, really good. You have a little tiny bit of bleeding, but of course when you do injections, that's normal to have it. Yeah, exactly. Go ahead and face me this way. I always tell my patients if I don't see bleeding, I'm kind of thinking like, what do you have in there? You know, do you have good blood supply? Where's that blood? All right, go ahead and smile big again. Good, relax. Good, we're gonna do a little more injection right up here, so a little pinch. No, these are a little more tender. Good. Go ahead and smile big again. Good, relax. A little pinch right here, pinch. Good job. And then smile big again. Good, relax. Good, here's a little pinch. Little pinch. I know this is a pinchy one. Last one. Good job. Perfect. Awesome. So just the ones around the mouth. Those muscles that kind of pull the corners of your mouth down. We're gonna do those next. So go ahead and make that pucker, or that, not the pucker face, the pouty face. There you go. Good. Good, and yours really sticks up that muscle. So I can really see this is cheek, And then this really isn't moving, but if I go right there, that's where your muscle is. So go ahead and relax. Good, and then I'm just gonna do a little pinch here, pinch. Good job. Same thing on the other side. And then I just do kind of a quick wipe off, and I'll give you all of those post-care instructions, okay?
Okay.
Go ahead and make that pouty face again. Good, relax. Good, little pinch, pinch, good. How are those? Not too bad, right?
Not too bad at all.
Good.
That was not bad. If pain is an issue, don't let that stop you. That was not bad at all.
Yeah. Most people get really worked up about it. You know, they'll come in and they'll tell me about some awful story that they've heard somewhere from a distant friend that nobody knows the name of, and then they come in, I do a few injections, and they're like, that wasn't bad at all, and everything's fine after that. But
It's kind of like tweezing. It's like a
yeah,
prick,
it's like a little, you know, I mean, you feel sensation, but it's not so much that it will stop you from tweezing, right?
No.
Exactly. So I'm just taking off those little white dots. You're going to have a little bit of redness in the area that I just injected. That's to be expected. That's just, you know, anytime you do an injection, your body sends some inflammatory proteins and things to the area, so you're a little bit red. That will go away within about 30 minutes, so you don't have to do anything, okay?
All right.
No rubbing the area,
Okay.
no exercise, no lying down completely flat for the next 4 hours.
Okay.
Those are your big no-nos right now, okay? And the biggest reason is because when I do the Botox, I put it into specific muscles, and then if you start going like this or rubbing, you can move it into other muscles.
Oh.
So you just have to be a little bit cautious, at least for the next kind of, you know, a few hours.
Okay.
Just to make sure that it doesn't go anywhere where we don't want it to go, okay?
Okay.
And the biggest thing I think, especially in Arizona, that I see is people who have allergies, or they'll sit up and go, oh, no worries, doctor, and then they'll go, oh, but my eyes itch so bad because I've got allergies. And I'm like, just make sure, especially around your eyes, you don't want to be moving that around, okay? Perfect. And I can give you a little bit of an ice pack if you want. Yeah, I was going to say, it really goes away so quick. Doesn't look like we have any bruising or anything, you know, anything to be worried about. Yeah, perfect. All right, and then I'll see you back in 2 weeks, and then we'll go from there. We can always add a little bit more Botox, but of course it's your first time getting it. We want to make sure that you like the results. Okay. And we can always do a little bit more at that visit and talk about some more treatment options. Okay.
All right.
Awesome.
Well, thank you.
You're welcome.